Student retention. It is a huge focus for all of us in the classroom. What are some of those strategies that we can implement to make sure that our students stay fully connected, engaged, and are competent in the skills that we are teaching in the classroom every day? Welcome back, everybody, to Dr. Sellers Educate. We're thrilled that you're back as we continue to support you on your journey towards success. If you are on the journey towards renewing your C&E, we're happy that you're back as well. In this snapshot, we will be talking about what are those key strategies to make sure our students are fully prepared for the workforce. We are seeing many nurse educators engage with healthcare partners to make sure that we are fully equipped with the knowledge that we need in order for students to be successful when they get to the clinical sites. But before students get to the clinical sites, what are some steps that we can take? Let's take a look at our content in this episode, and we will talk more about what are those key steps that we can take. Unlocking our learners' potential to fully engage in the classroom really is centered around some of the work that we will take a look at in Billings and Halstead. Okay, so if you have your resource, go ahead and pull it out. It will be Billings and Halstead Teaching and Nursing. Right now we're in the 6th edition, and make sure you print out that study worksheet every single time you show up for an episode so you can stay focused on what your priorities are. On that study worksheet, I want you to go ahead and fill out today's date, whatever the date is for you that you're watching this episode. Also, I want you to fill out the section under the objectives. So what is it that you want to walk away with after this episode and having a better understanding? All right, so let's go ahead and jump into our content. Our thought-provoking question for this episode is taking a look at engagement. What are some of those key considerations for engagement that we want to think about? Okay, remember that with the thought-provoking question, it is exactly that. We want you to think about what are some of the key concepts that you want to focus on to help you close your knowledge gaps if you don't choose the correct option. All right, so let's take a look at this question. Engaging in high-impact teaching practices that foster engagement and clinical application is a best practice in nursing education. Which teaching strategy and a health assessment course would be most supportive to engage students in critical thinking during the skills lab experience? We have A, mini lecture during skills lab with PowerPoint slides, B, student observation and demonstration of skills, or C, small group discussion of an unfolding case study. You do notice, I'm sure already, that there are only 3 choices here. We know that the CNECL exam has been changed to offer only 3 options. Right now, the CNE still offers 4 as of this episode being launched. However, that may change, and as we get updates, we will certainly let you all know. All right, so now we're going to take a look at what are some of those benefits of a learner-centered ideology, and what does that even mean? Well, this ideology is centered around us focusing on the needs and the interests of the students, and what are those specific objectives that we want to make sure students are able to achieve. We have listed out student learning outcomes for our nursing programs, but we also have learning objectives for our courses, as well as clinical learning objectives for our clinical experiences for our students. And we also have skills lab and simulation lab objectives as well. There are 4 categories that we want to focus on when we think about describing steps to take to unlock the learner's potential. They include enhancing the learning experience and engagement with our students, describing and defining what those student learning outcomes are, ensuring that they are learner-centered. What are those key skills developmental areas that we want to hone in on, and clinical judgment. Okay, we think about Tanner's clinical judgment model. That will be the focus area for that category. The first strategy to unlock the learner's potential under enhancement of learning engagement and motivation is to ensure that we are focusing on the learner's objectives. Okay, so what learning do we expect students to start with at that foundational level? It is the core of the experience. We think about Bloom's taxonomy, and that lowest level of learning being remembering. We want the students to be able to establish that solid foundation where we're able to scaffold the learning over time so that we can indeed ensure that they have learned those key concepts that we expect them to at the lowest level. The second category we're taking a look at are those student learning outcomes. What objectives do we expect students to be able to meet at the end of the course? We want to think about the learning path, both from an individualized student perspective as well as general. So general is going to be what the learning outcomes and student learning objectives that are specifically designed for that course. And then for the individual student's learning objective is going to be based on their preferred learning styles. We want to engage students in a way that's going to allow them to be motivated as a self-learner, aligning with Knowles adult learning theory. We also want to consider the VARC framework to ensure that we are introducing key teaching strategies that will engage and really connect with all 4 different learning types and styles. All right, and remember that even though we may not know or remember each individual student's learning preference or style, the goal is that we are able to integrate a variety of teaching strategies in our classroom. All right, and if that's a muddy point for you, go ahead and turn over to page 288. That's where you're going to see in Billings and Halstead textbook a description of excellent teaching strategies. That's where it starts, and then it's going to continue through the end of chapter 16. You also want to focus on table 16.1. Okay, we'll be talking more about Bloom's taxonomy and what are those strategies that we want to consider to align with the topic that we're talking about, which is, again, engaging the learner to allow them to maximize the learning experience that they're having in our classroom. The next category is looking at the long-term skill development. When we develop a course, we certainly want to think about the sequence of content that we're including, but we also want to consider the lifelong skills that we want students to also be able to walk away with. As a nursing profession, we want to best prepare our nursing students through an engaging curriculum with evidence-based strategies that we're using for course development, allowing them to complete a self-assessment and to engage in embracing and adopting these lifelong skills. One good example is going to be time management and prioritization. Okay, those are the 2 that come to mind. And so we know that students can sometimes struggle, especially new graduates, when it comes to delegating, prioritizing, and time management. How are we incorporating within our curriculum across every single semester? So we want to consider the leveling that's happening so that students are progressing with some of these long-term skills that they will need to have in order to achieve the delivery of quality patient care in the clinical setting. All right, and then our last category is clinical judgment, looking at Tanner's clinical judgment model. We want to consider scaffolding that happened, reinforcement that takes place throughout the Tanner's clinical judgment model, giving students formative feedback so they can reflect on perhaps the good practices that they had in the clinical setting, and then any changes that they need to make. We want to advance these levels of learning as we think about Bloom's levels, starting at that lowest level of remembering, scaffolding to application, analysis, and that highest level, which is creating. All right, and then that's going to take us to the next segment that we want to take a look at, which is on page 288, table 16.1. But before we do that, going back to the thought-provoking question, if you chose B, student observation and demonstration of skills, you are correct. And if you did not, let's talk about it a little bit, okay? So if you thought about choosing A, I just want to reiterate that the question was centered around what specific engagement activity should we plan for in our skills lab with our students. Remember, we want to maximize the students' learning experience, especially in the skills lab, because we know that our time can be limited with our curriculum. There's so much content to cover. So we want to maximize with hands-on experiences as much as we can when students are in the skills lab. This is a great time for them to practice. So this is why option B is going to be the best choice. We do not want to engage students with many lectures in that skills lab because we want to, again, allow them for those engaging activities where they're observing and demonstration of skills. Okay, and C, same thing, small group discussions. That is an activity that we will want to engage in the classroom setting, but we want to maximize observation and hands-on experiences in the skills lab. Okay, so that's why A is not the best answer. Remember that when you are sitting for the C&E exam, or even if you're here just to advance your knowledge and skills, when we see skills lab and critical thinking, we certainly want it to be at a higher level, which would be application or analysis level. Students having a chance to demonstrate those skills, we're able to give that formative feedback so that students can make corrections, hopefully, and improve their clinical decision-making and critical thinking skills. All right, so that's why B is the best choice, but don't get discouraged. Remember, again, that these are thought-provoking questions. And if you're still unclear about the specific content area, then again, you want to take a look at chapter 16. All right, so now let's talk about table 16.1, the 4 knowledge dimensions of the revised Bloom's taxonomy, focusing on the factual category, which really describes the basic content that we expect students to know. So this is the must know category, just the facts, right? Black and white. And then we have the conceptual knowledge category, where students are expected to be able to comprehend relationships between the basic concepts, such as the blood pressure and why we want to listen to the heart sounds when we're doing a health assessment, especially of the cardiac function. So how does the blood pressure, how is it related to the heart sounds, as an example? Same thing with lung sounds. How is it related to the respiratory rate? Okay. And then we have procedural, thinking about the skills, as an example, how students are able to perform the head-to-toe assessment, what techniques are they using, and then metacognitive is the last category, where students are expected to have an awareness of their own cognition, in addition to just general understanding of what's required related to that disease process and concepts that they need to comprehend in general. The next step is thinking about what are some of the teaching strategies associated with these specific categories. As an example, table 16.1 says that for conceptual, a good example of a teaching strategy would be debates, cooperative learning, group assignments, mind mapping, concept mapping, flipped classroom, and role play. Well, debates is one of my favorites, so that's definitely an activity that I enjoy engaging with my students when I'm in the classroom in person. And of course, it depends on the setting, because if you have students online, that can be a little bit of a challenge to engage in a debate, but it is something that you can certainly consider for the in-person students. All right, and then last is just summing up kind of what we talked about today, making sure that you are taking the time to review the content. It is very important, if you're on the journey to C&E clinical or C&E novice, that you take the time to look at your textbooks, to write on your study worksheet what your takeaways were, what your next steps are to ensure you're closing your knowledge gaps. If you have any other questions, you can reach out to us, info@drsoeseducate.com, and we will see you next time. Have a great one, everybody. Bye-bye.